So you've probably figured out that newborns are not like little adults. I'm Dr. Kerry Fierstein, Chief Executive Officer of Allied Physicians Group, practicing pediatrician for over 30 years, mother of 3, and now grandmother of 1. Let's go over a newborn exam today.
Very alert. So just looking at a baby, a healthy baby tends to be flexed. Sometimes when they're first born, their color is a little bit yellow. That's normal. All babies are a little bit jaundiced. If you're concerned at all, you should talk to your pediatrician about that. Jaundice tends to start from the head and go down. So a little bit on the face and on the chest is normal, but again, review that with your pediatrician. When new moms watch their babies, they know why they got kicked so much inside, because they do tend to move around a lot. So this baby's head is nice and round, but that's not always the case. Sometimes you'll notice that they're pointy for the first few days of life, and that's because of how they came out of mom. There's a soft spot right there. You can touch it, it's not dangerous. Sometimes you'll actually feel a pulse there. There's another little soft spot in the back, which most people don't talk about. That closes about 6 weeks. This one closes 9 to 18 months. Babies can see, but they don't see 20/20 like we do. A newborn probably sees about 2200, so they definitely do better with contrast like black and white or bright primary colors like red. Babies sometimes have a little bump under the nipple. That's normal. That's from mama's hormones. If you press on them, sometimes you'll get a little milk out. Don't worry about that. That tends to get better over time. Babies come home from the hospital with the cord. The cord comes off, falls off by itself in about 7 to 14 days. Just try and keep it dry. So fold the diaper underneath it. A newborn little girl, you might see that her labia are swollen. That's totally normal. It gets better. The circumcision, as it heals, will have a little bit of yellow on it. Kind of like if you cut the inside of your mouth, that can be normal too. Babies tend to have often cold hands and feet. Sometimes they're blue. It's not dangerous at all. All babies peel in the first month of life. This baby hasn't started yet. You can use lotion. They'll smell better, they'll look better, but they'll still peel. It's very common birthmarks, or a little red line right there. This baby has a little bit of it. When they have it there, oftentimes they have a little bit on the eyes. Those always go away, but can take a year or two. When they have that, they often have a little red spot in the back. That doesn't always go away, maybe about 50% of the time, but it's always covered by hair. The next time anybody has to worry about it, it'll be his wife when he's much older. People ask about cutting babies' nails. You can file them or you can cut them. Never clip them. Clippers are much more likely to cut the skin. Thank you for tuning in to Trusted Pediatric Advice.